page number 417. So in this chapter, we will actually essentially just discuss about how each of different types of nutrients are important in maintaining an optimal organ health with regards to different systems in our body. Okay. So first we'll start with the oral health. So things that can destroy the oral health and things that can make sure you have a good oral health. Okay, so these are the listings out here. It's more or less very similar to what is given in the textbook. There is an image given in the textbook on page number 417. Okay, the first small image. That is very self-explanatory. If you understand that particular image, it's quite self-explanatory. So we'll start with this. Carbohydrates, fermentable. If you have lots of fermentable carbohydrates in your diet, so for example, free sugars, okay, short chain carbohydrates and all, okay, that may stay back in your teeth and it can lead to dental caries. Okay, and then you have presence of specific biofilm bacteria. Here, biofilm refers to plaque formation. Can anyone say in the chat box what do you mean by plaque? It's a very common terminology. If you see an advertisement on, no, it's not bleeding gum. Yes, thick yellow bacterial layer. Okay, whenever you have some food particles left back in the teeth and you don't brush properly, okay, that can these particles are susceptible to bacteria colonizing, and then there will be a bacterial biofilm forming over this area. Biofilm means what? It's a protective layer which actually protects the bacteria within. Okay, so there are things that have stuck in the grooves of your teeth. Okay, and bacteria has formed, bacteria has colonized this particular area, and there is a biofilm that is formed to protect this bacteria. Okay, so this biofilm won't allow your body's natural immunity or resistance to penetrate through this plaque and destroy the bacteria. Okay, it's very difficult once the biofilm is formed. So this bacteria along with this biofilm is called plaque. It's usually whitish and yellowish in color. If you check any advertisements on toothpaste and all, no, it's very they show the animation of all these plaques. Okay, so next we have susceptible tooth structure. For example, malocclusion. Malocclusion is a medical terminology which we use for crowding of the teeth. You may have noticed that not everyone have a very well set of teeth. Okay, some of them have crowded teeth. Okay, it's not properly aligned. Some people may have bite issues, overbite, underbite. Okay, orthodontist will take care of this. Those who have malocclusion may require braces and all to get the teeth aligned properly. Okay, so in that case, in people who have malocclusion are more susceptible to dental caries. Okay, as compared to people who have proper perfect alignment of teeth. The newly erupted teeth, exposed cementum. Cementum is a part of, it's a calcified area of the tooth. Okay, if cementum is exposed, if you have acidic food or you have too much of sugary food, it can destroy the cementum, and essentially it will expose your root canal of the teeth, and it will lead to, if there's a cementum over a period of time, it gets destroyed. That's how you get teeth sensitivity and all. Okay, then you have absence of fluoride. Any good source of fluoride which you can mention in the chat box? Anyone? From where do you get fluoride essentially? Yes, water is a very good carrier for fluoride. The drinking water which you have, it should essentially have certain amount of fluoride, which will help your oral health. Okay, and in some cases, most of the toothpaste will also have fluoride elements to it to help in oral hygiene. You do not require and a supplement of fluoride and all. Do not go there. Your water essentially should have fluoride. Okay, so don't fall for such marketing gimmicks in the future. Then salivary glands hypofunction. Your saliva essentially has enough immunity and resistance to kill the bacteria which comes into the oral cavity. If your salivary gland is hypofunctional, it's not functioning properly, or the quality and the quantity of the saliva produced is not enough, it can lead to impaired oral hygiene. Then poor oral hygiene, not brushing your teeth twice, okay, not brushing your teeth on a very regular basis, and not rinsing your mouth after having food, not rinsing your mouth especially after having some sugary food or any acidic food. If the sugars and acids remain back in your uh, oral cavity, it can essentially lead to dental caries. Okay, so in detail is given in the textbook from page number 417 to 418. Okay, so in which you must have known that we get the permanent set of our teeth. The permanent dentition takes place after a certain age in childhood, up to the age of from 10 years to 15 years. The normal permanent dentition should come into the place. Okay, so what does it mean? Okay, this is the early late childhood and the early adolescent stage, and this is the time when all of your milk teeth should fall out and your permanent dentition should come into should replace your milk teeth. Okay, so what this essentially means is this is a very prominent time for kids and early teenagers. Okay, teenagers in who are up to the age of 15, early adolescents, especially for this age group. If their diet is deficient in calcium, vitamin D, vitamin A, or any other essential nutrients, these kids are prone to getting dental caries, malocclusion. Okay, they may have issues with oral health in the future. So this is the age where you have to make sure, even when you meet your clients, they have kids or they are planning for children, you can give this kind of education to them. Late childhood to early adolescence, do not miss on the intake of vitamin D, calcium, and all the other essential nutrients should not be missed, because this is the time where a foundation for a good future oral hygiene is formed. Okay. Then for pregnant ladies, when a woman is pregnant and if her diet is deficient in vitamin B complex or all the vitamin B complexes, it was shown that when she has a baby, most probably the child may have cleft lip or cleft palate. Okay, what happens in cleft lip and cleft palate, you can google that. Children who are born without the proper attachment of the upper lip on the upper palate, the roof of your mouth. Okay, or the roof of your oral cavity is called upper palate. So kids who are born with cleft lip and cleft palate, it is seen that when the mothers were pregnant, the diet was deficient in vitamin B complex. Okay, and caries is promoted, dental caries is promoted by having too much of sugar and acid in your food. So you can just read through these topics. It is very self-explanatory. Just read through once. All the important points I will be mentioning in these presentations. Next, coming to bone health. So bone mass is the density and the essential complete entire weight of your skeletal system. Okay, so 90% of an adult's bone mass by the end of their adolescence, 90% of the adult's bone mass is already present. So, and after this adolescence, whatever bone mass you already have up till the age of 19 or 20, okay, this bone has to last for your entire lifetime. Okay, so this especially the age of early childhood, late childhood, and adolescence, this is the age where profound importance should be given on calcium and vitamin D. Okay, so because the bone mass which you get, which is formed, okay, during this particular phases of life, that has to last for an adult's entire lifetime. Okay, These are the different factors in the image you can see here. These are the different factors which affect the increase or decrease in the bone mass. Okay, first is nutrition. All the macronutrients like protein, fat, carbohydrate should be adequate, and micronutrients like all the vitamins and minerals, calcium essentially, vitamin D especially in this bone criteria for bone health should not be deficient. Okay, and the lean and fat tissue, for example, if somebody is obese, overweight, they are more prone to have a low bone density. Okay, people who are overweight and obese are more prone to fractures. Okay, their bone density loses over a whatever bone mass they may have accumulated in their adolescence. If they turn overweight or obese in their early or late adult life, this bone mass, all the calcium which was stored in the bone, it will essentially go out from the bone into the bloodstream and out of the body. Okay, so that's how they lose their bone density over a period of time. So obesity will affect the bone mass. And physical activity, those who are having sedentary lifestyle or moderate to sedentary lifestyle, their bone density is comparatively less as compared to active people. Okay, then hormones like aging. What do you think, how aging affects your bone mass? Everyone should know that. How aging affects your bone mass? Will your bone mass decrease with age or increase with age? Decrease. Also, in which gender would you see, in which sex would you see a steep decrease in bone mass? Is it women or men? Yes, especially post-menopausal women. Okay, remember that osteoporosis is a very common disorder, which especially which you see in women after the age of 35, and this risk doubles when they reach their menopause. Okay, so hormones like the parathyroid hormones, PTH is parathyroid hormones, and then you have calciferol hormone. Okay, calciferol hormone is is essentially an enzyme which your liver will react with and convert it into vitamin D for your body to utilize it. Okay, and parathyroid hormone, that will control the levels of calcium in your blood. Essentially, when your blood's calcium level comes down, parathyroid hormone will help the bones to secrete to give up their calcium ions into the bloodstream. Okay, and what happens if there is too much of calcium in the blood? Anyone? Too much of calcium in the blood. Renal stone, true. Kidney stone, because whatever is the quality of the blood. Okay, when the blood, all the blood has to pass through your kidney to undergo the filtration. Okay, and during this filtration, calcium, if the blood has high calcium levels, it gets deposited in the kidney. Okay, and the blood will convert into urine, and again reabsorption will take place. Okay, that is second part. But calcium molecules cannot pass through the semi-permeable membrane. When there is a lot of calcium molecules present in the blood, they essentially they cannot pass through the semi-permeable membranes of the kidney, and thus you get kidney stones. Over a period of time, when these calcium molecules accumulate over each other, they turn into kidney stones. Okay, so this is how different factors will affect the bone mass. The thing which you have to remember here is 90% of the bone mass is achieved by the end of adolescence, and you have to maintain that till your to the end of your life. Okay, so calcium rich diet for children and adolescents and teenagers is very essential. And calcium is a mineral which is used for bone building and for your enamel building, etc. I guess it is very known to all. Vitamin D is essential. Why vitamin D is essential? Because vitamin D will help your body to absorb calcium. In the absence of vitamin D, your small intestine, they cannot absorb calcium for the utilization of bone mass. So if you have deficient, if somebody is deficient in vitamin D, it will lead to rickets, or which is the symptom is soft bone. Okay, the bone is very soft. People are prone to fracture in this case. And various vitamins that affect the health of the bone is given in the table 23.1. You can just read through that. All the deficiency can lead to what disease. Excess of this particular vitamin and minerals can lead to what kind of disease. It is given in table 23.1. You can just go through that. Then coming to eye health. So these are the all essential macronutrients and micronutrients which should be took by an individual to maintain an optimal eye health. Okay. The disease conditions which are given in the textbook is, one is cataract, and then you have macular degeneration. So cataract means it's a cloudiness of vision. It's very common among the senior citizens. Okay, so what happens is the UV radiation, uh, ultraviolet rays from the sunlight, it can damage the cells and the lens of your eyes, and thus it can lead to the protein, it can damage the protein of the eyes, and thus it will lead to cloudiness of vision. That's called as cataract. So if your diet is rich in antioxidants, because what UV radiation, we will learn about this in the chapter of antioxidants. Okay, oxidative stress and all. Okay, just understand that UV radiation is something that will cause the release of lots of free radicals, and it will cause oxidative stress on your cells. So if your food has enough amount of antioxidants, they can fight with these free radicals, and they can essentially protect your eyes from undergoing any UV damage. Not just eyes, your skin in general, your entire body in general. If your food has enough amount of antioxidants, UV damage can be prevented to an extent. Then you have macular degeneration. Macula is a small region in your retina. Can anyone say in the chat box what is the use of retina? Retina is a part of the eye anatomy. Okay, so I guess everyone should know that even in your basic schooling in the science section, biology section, it is been taught, and nobody should forget that. Not just the science students who are present here, but also for the commerce student. What does retina do? How does it help in your vision? Obviously, it is related to eye. Yes. So obviously it will help in vision, but how? Image formation. Yes, senses light and sends the image to the brain. It has, retina has photoreceptors. Okay, photoreceptors, as well as the cells called rods and cones, not just the light but also to perceive the colors. Okay, you see the world, how colorful it is, depending upon how you have a photosensitive cells in the retina as well as color sensitive cells in the retina. Okay, so that's how retina helps. So macular degeneration, obviously your perception of light and your color sensitivity will decrease over a period of time. With aging it does happen, that's a natural process. Okay, but with deficiency of certain nutrients, this can be accelerated. Okay, this condition can be accelerated. So the macula is a small region in your eye, especially it will perceive the light. Okay, photoreceptors are present in this macular region, so it will undergo degeneration. Okay, so why it undergoes degeneration? It is because of the again oxidative stress, the free radicals and the oxidative stress from UV radiation, pollution. Okay, sun exposure, smoking, these all things will cause the oxidative stress. And how you can prevent this? You should have dark green leafy vegetables. Especially underline the term dark here, because there is certain nutrients, especially two particular minerals which should be required, that is lutein and zeaxanthin. Okay, it's given in the textbook. It's not here in the image. You can read the textbook, underline that. Lutein and zeaxanthin. Those who will get the textbook, you can refer to that later. So are these two are essentially present in dark green leafy vegetables. Okay, but they are lesser in amount in other green vegetables like broccoli, Brussels sprouts, or other green vegetables. It's very less in amount, but dark green leafy vegetables like spinach or other methi leaves, okay, fenugreek leaves, and all these leaves are very dark in color, and it means that they're essentially very rich in, yeah, kale also. Any dark, any green leafy vegetables which is very dark in color, and not just the green vegetables. Okay, so that are the rich sources of lutein and zeaxanthin. So that will help in the prevention of macular degeneration. And then you have zinc. Zinc, how it helps is, zinc is present in red meats, beans, nuts, cereals, oysters, etc. Zinc will help the vitamin A to reach different parts of your body. Zinc helps in the absorption of vitamin A. So if your body is deficient in zinc, it will lead to indirectly it will lead to deficiency in vitamin A. Vitamin A will not be properly absorbed in the body. And you know what is the deficiency of vitamin A? I have briefly touched about that. Anyone in the chat box, if somebody is facing severe deficiency in vitamin A, which part of the body will be affected? Yes, if a child, especially child and all, they are severely deficient in vitamin A, it can lead to blindness. Okay, so vitamin A is very much essential for your eye health. So in that case, zinc is also very essential to make sure the cells of your eyes get the derivatives of vitamin A. Then vitamin C, it will support your ocular blood vessels. Ocular blood vessels means the blood vessels of your eyes. Okay, it will support the health of the blood vessels of your eye. So blood flow is not hampered. Then vitamin E, again, it is an antioxidant. It protects the eye from environmental damage and free radicals through sun exposure, etc. Omega-3 fatty acid, which is found in flax seeds for vegetarians, and it is found in fish liver oil and cod liver oil. So that will also help in the health of your blood vessels, ocular blood vessels, eye blood vessels. It will also prevent the cell damage. And if any arterial plaque is there, again, plaque is something that is deposited in the blood vessels here, especially when you're speaking about arterial plaque. Cholesterol will lead to plaque. Okay, so too much of cholesterol will lead to plaque. Flaxseed is essentially a very great source of omega-3 fatty acids. You do have other nuts and seeds available, but it is seen that flax seeds gives the best essential. Little amount of flax seeds can provide the sufficient amount of omega-3 fatty acids. If some nuts and seeds do have that, but you may have to indulge more, and they do come with a fat component, so that will not be too healthy. Okay, in flax seeds, the other fat components are less, but omega fatty 3 acid fatty omega fatty acids are good in amount. That is why we refer flax seeds. Then supplement of beta carotene, that is a derivative of vitamin A. Vitamin C, E, zinc, copper can reduce the risk of macular degeneration, as discussed. So these are all the important vitamins and minerals which should be there in your diet, so that you have a good eye health. And other disorders like cataract and retinal degenerations, etc., can be prevented to an extent. Then coming to skin health, essential fatty acids, again, It will help in your epidermal permeability. For example, um, some amount of moisture is lost from the skin, from the surface of the skin. Okay, that is called transepidermal water loss. So if your body lacks in essential fatty acid, this water loss is too much. Okay, so your skin becomes very much dehydrated if your body doesn't have enough essential fatty acids in store. Okay, so to prevent dehydration, your diet should have enough amount of essential fatty acids. Then coming to vitamin C, uh, can anyone say how vitamin C can help in skin health? If you are into cosmetics, skincare, and all those things, you should know that. How vitamin C will help in skin health? Yes, vitamin C is an antioxidant. It helps in collagen formation. And one more thing, it helps in wound healing. Okay. Yeah, to control melanin, we have other actives like niacinamide and all alpha arbutin. Okay, that's another topic, or skincare actives. Okay, to control melanin, we have other specific actives targeted for that purpose. For vitamin C, consider it as an antioxidant. Before you apply sunscreen, you should have one an antioxidant layer so that your sunscreen doesn't undergo oxidation and cause harm to your skin, than protecting it. Okay, collagen formation, um, having not just applying vitamin C but having foods rich in vitamin C, both in both this way it will help in collagen formation. If you completely rely on applying vitamin C and not taking sufficient amounts of vitamin C, that will not help in collagen formation. It should come from from topical application as well as from within, from your nutrition. Okay, from both these part it will help in collagen formation, wound healing, etc. Okay, and that's so I guess you know what is the use of vitamin C. Okay, and then we have copper. Again, it helps in collagen formation. It will make your skin, if any wound is there, to make sure that it bounces back soon enough. Copper is essential. Then protein, collagen itself is a protein. Okay, it's a protein bond. So if your body lacks in protein, your collagen will not be formed, because over a period of time, your the protein bonds also undergoes oxidative stress. It has to be replaced. If enough protein is not there in the body, uh, you may have early wrinkles in your skin. Okay, so to keep the skin supple and healthy, enough protein should be there in the diet. Then you have zinc. um, Zinc acts in both ways. It is somewhat bactericidal, antibacterial. It can prevent certain skin infections to an extent. Then coming to vitamin A, now we have a lot of studies being done on vitamin A, not just the supplements, but also the topical application. But too much of topical application of vitamin A can lead to skin irritations. Okay, like you have retinols. Okay, so the retinols is essentially retinols. Okay, retinoin. Okay, these all are the royalties of skincare regimens and all. But too much of indulgence in this, especially topical application, it can lead to skin irritation. It can lead to skin sensitivity. So that has to be taken care of. Vitamin A, intake of vitamin A also, you have now if somebody is suffering from severe acne issues and all, too much of pimples, severe acne issue, even if it is hormonal or not so hormonal, they are put on this Accutane regimen and all. Accutane essentially it is vitamin A, high component of vitamin A. Those who do take that, those who have undergone the Accutane regimens, they would know how vitamin A supplements affects the skin. Your skin becomes so dry, even if you laugh, even if you eat, smile, it can crack. Okay, that's how difficult it is to put someone on this vitamin A treatment for acne, or to reduce the skin aging, etc. Then you have beta carotene. It's a derivative of vitamin A, again for skin health. The same, it works the same way. Then you have B complex, vitamin B complex. If you are deficient in vitamin B complex, can anyone give an example of uh, what would happen to your skin if you are deficient in B complex vitamins in respect to skin? Yeah, that will be in the nails, in respect to nails. When we come to nails, we can discuss on that. Can anyone give an example of a vitamin B complex active which is very well known in skincare? Anyone? It's a serum. It is found in serums. It is found in moisturizers. Yes, niacinamide. Okay, niacinamide is it is derived from niacin. That's a vitamin B complex antioxidant, as well as if your body is deficient in vitamin B complex, you will lose the like essential glow which your skin has. Okay, that will go over the time. On top of that, even with small tiny wounds, okay, even with a small crack or small tiny wound, it will lead to a severe this melanin formation. Okay, it will lead to lots of pigmentation. So vitamin B complex will make sure that you do not go into an hyperpigmented stage. Okay, and it is also acting as a certain vitamin B complex, not all. Certain vitamin B complex vitamins will act as antioxidants also. So niacin, that is derived into made into niacinamide. Okay, so that's an example of vitamin B complex, very much well known, active in skincare these days. So for topical application, but even for you should have a focus on what you eat also. The amount of vitamin B complex that goes in your body is very much more important than what you apply on topical applications. So that was about skin health. So yeah, copper and all, we will copper one, there is a one disease. Okay, we'll discuss that in the next slide, that we will understand. So the final topic is hair and health. Okay, so what is the full form of SAM? Those who are attending all the classes, we have done a chapter on this. Yes, severe acute malnutrition. Okay, basically a lot of examples of severe acute malnutrition will be protein deficiency. Okay, like kwashiorkor, marasmus, and all. I guess please keep revising on this. It's very important topic from exam point of view. Severe acute malnutrition. We have covered that. Repeated class will come soon. So the children who suffer from severe acute malnutrition, you can refer the chapter on this also. You can see images given of children suffering from kwashiorkor, marasmus. It is given in the textbook. Refer that and identify how the skin is different, how the hair is different. Okay, what happens to the children, their physical form, what are the signs and symptoms which indicates to these different types of severe acute malnutrition. Okay, the skin changes, it is very much evident on skin, hair, nail health, etc. It is very much evident. So to understand the changes of hair and health because of severe acute malnutrition, please revise that chapter. For new students, that chapter will be coming up again. So revise the severe acute malnutrition, understand the difference between kwashiorkor, marasmus, what are the different signs and symptoms, how it is different from each other, understand that, and identify how hair and nail health, hair and skin also is essentially what signs and symptoms affects the hair and skin in these two diseases, kwashiorkor and marasmus. Okay, then we have Menkes disease. This is a disease which is caused by a copper deficiency. Okay, not essentially copper deficiency. It is very rare for an individual to go into a state of copper deficiency. The thing that goes wrong in this disease is it's a metabolic disorder. So what happens is, even if your diet has enough amount of copper, your body is not able to absorb it. Even if your body is able to absorb it, your blood is not able to transport the copper to all the essential places. Okay, so Menkes disease, again, it is given in the textbook. Image is also given. Okay, there are different symptoms of what this copper deficiency will lead to. Your brain requires copper for its optimum functioning. So the children who have Menkes disease, they have mental retardation and growth retardation also, changes in skin color, changes in the eye color. Okay, that's, and their hair, it is hypopigmented. It becomes very much hypopigmented. It's not dark, it's very light hair because of copper deficiency. Okay, then acrodermatitis enteropathica. This first image which you can see here on top, that's an example of acrodermatitis enteropathica. That is diffuse hair loss. Okay, because of this, it's a dermatitis. Dermatitis means inflammation of the skin. Okay, that will lead to diffuse hair loss. In patches, your hair will be lost, and this affected area, which you can see, it will be very itchy. Okay, inflamed and very painful. It requires a medical treatment. Okay, and you have iron deficiency. Iron deficiency and hair loss are interrelated, very much linked. Studies are still going on to find out the exact relation between iron deficiency and hair loss. Okay, to come to a conclusion, but it is seen that the people who are anemic, they do face an excessive amount of hair loss. Hair loss does take place. It's very normal. Your hair goes through different cycles. Okay, each strand of hair goes through different cycles, like telophase, anaphase, etc. So there is a phase in which the hair sheds. Okay, you can see some excessive shedding in your hair with every 2 years or 3 years, and that's quite normal. Not every strand of the hair is going through this phase at the same time. Okay, so but if somebody is having iron deficiency, the shedding phase of the hair, okay, that is accelerated. Usually you should have the shedding phase of the hair in every 2 to 3 years, but people who are iron deficient, they see severe shedding of their hair every 6 months, every 1 year and all. So that is how iron deficiency affects the hair health. And also there is spoon shaped nails, which happens because of severe iron deficiency. Okay, and brittle nails, this second image which you can see here. Okay, koilonychia, it is given in the textbook. You can underline that later. Okay, so koilonychia means spoon shaped nails because of severe iron deficiency. Spoon shape as well as brittle nails. Then you have vitamin C deficiency. Vitamin C deficiency will lead to enlargement and keratosis of your skin. Keratosis means it's a mold-like presence on your skin. It feels like something is stuck on your skin, like warts and all. Okay, brownish, blackish, mold-like presence on your skin, but it is actually not mold. It is your skin that has undergone keratosis. Okay, keratosis means your normal differentiation of your skin should take place, normal shedding of the skin, new skin is coming up. But in keratosis, what happens is normal shedding will not take place. The skin cells will undergo stratification, means it will undergo pigment changes, as well as it will undergo thickening, and because of that cluster of molds will be present. Okay, so that is how vitamin C will affect the hair and nail and skin health. Okay, and vitamin A toxicity, too much of vitamin A, that can also lead to severe hair loss. Okay, too much of vitamin A can lead to severe hair loss, especially as I told earlier, those people who are under treatment of acne. They are given, if they are under the Accutane treatment and all, too much of hair loss is a side effect, very common in that case also. Too much of vitamin A. So vitamin A, the main use is uh, your skin every day. You know that your skin, the old skin is shed off. Some of the, not the entire body. Okay, most of the regions, the old skin cells sheds off, and the new skin cells come under it in the epidermis and the dermal layer. Okay, so vitamin A creates a balance of this shedding of old cells and new cells coming up. Okay, so when the body goes into a deficient state of vitamin A, this shedding and renewal of cells will be affected. Okay, so that is why most of the anti-aging creams and all, they use vitamin A, different forms of vitamin A in forms of retinols, retinoids, etc. So what happens is over the period of time with age, okay, your skin generation, yeah, the skin differentiation, cell differentiation will reduce. Okay, so you require vitamin A to maintain that skin differentiation, and old new cells replacing the old ones. Okay, so that is the essential use of vitamin A, and it will make sure your body doesn't go into a state of keratinization, means thickening of the old cells, and it is not dropping off. Okay, thickening of the old cells, stratification of the old cells. So vitamin A makes sure that that doesn't happen. So that is why vitamin A is very much essential for your skin health. Yeah, vitamin A, anything to does vitamin A toxicity cause dehydration of skin and nails? It will cause to a dryness. Okay, too much of dryness. It will cause dehydration, because dryness is a symptom of too much of vitamin A.